to Medicaid, which is jointly administered between the feds and the states. There are major reductions to federal health care spending here. One of the changes are these work requirements. It's about 20 hours a week, volunteer or work, to qualify for health care. What is the guidance you are giving to states on how to implement this? Because in this economy, things are more complicated. Uber driver, independent contractor. How do they show they work their 20 hours a week?
Last weekend, I was at the National Governors Association with Secretary Kennedy, who has been a big advocate of work as well. Every Democratic president and Republican president has said that the foundation of a healthy welfare system, of a social system of support, is work.
Right, but I'm asking how you actually implement that and register it so that people who are working do qualify and they don't get caught up in paperwork because they didn't file something on time. That kind
as long as we're okay that people should work and would want to work, and it's not just work, it's community engagement. They can go get educated, right? They can take care of family members. They can contribute in some other ways, but work's a great way of doing it and get you out of poverty if you can find jobs and elevate yourself. There have been efforts to do this in the past, but they haven't been able to achieve what we can achieve because we have technologies now, and we've invested already, as soon as the bill was signed, began pilots to try to demonstrate that we can actually do this correctly. We have pilots now in Louisiana and in Arizona. In both cases, within 7 minutes, you can click on where you're working. You mentioned Uber. You're an Uber driver. You click that button on your phone. It just takes you to your payroll provider. Let's say it's ADP. We then ask your permission. Can we connect with this payroll provider to demonstrate what you've actually been able to work and earn over the past month? This also, by the way, confirms your eligibility. But there's a bigger benefit here. Once you do that, you're in, you're done. However, what if we take one step further, Margaret? What if we go beyond just proving that you tried to work to actually saying, you know what, you didn't work enough, but we can actually help you by connecting you to your employment office.
So you're still figuring out the technology, but isn't there an end of December deadline for a lot of these things to be figured out? And how do you make sure that people don't get kicked off? Because in the state of Georgia, which already had work requirements, they have really struggled to make this work.
Well, a couple of things. It's not the end of December. It's the end of December a year from now. And Georgia's apples and oranges. Georgia had a program only for people under the poverty level. And for those people, if they wanted, they could elect to come into a system to help them get jobs. There have been 50,000 reduction in headcount of uninsured people in the overall program in the last 5 years. Overall, Georgia, 2 million less uninsured people. So Georgia's using a lot of tactics, and they're going in the right direction. I would argue that if you have confidence in the American people and their desire to take the offer to try to get a job, if we challenge you to that. And remember, if you're an able-bodied person on Medicaid, you're spending 6.1 hours watching television or it's leisure time. So you don't want that.
KFF Health Policy found 92% of adult Medicaid recipients already are working, or they have the carve-out because they have to have caregivers or they have to do other things.
They're fine. All they have to do is there'll be a simple app. If you've already carved out, that's super simple. If you're supposed to be, if you're able-bodied and you're supposed to be working, we want to help connect you to the job market and get you into work. We have twice as many jobs available in America as people who seem to want them. The foundation of work is not just about fulfilling eligibility. The goal of healthcare insurance is to catalyze action in the right direction, to get you healthier, to give you agency over your future so you recognize you matter and you should have a job there for to go out and change the world.
So there's a drug addiction problem in this country. How are those changes going to impact people who are on Medicaid in states like Kentucky, in states like West Virginia?
In many instances, they're carve-outs for folks who have substance use disorder problems. There are programs to support.
How do they prove that?
Well, they can either.
Is this in the app?
Yes, it'll be in the app. In the app, again, this is being developed by the United States Digital Service, led by Amy Gleason, who's a wonderful technologist. She and I were with the President and Secretary Kennedy and the head of the czar for AI in this country on Wednesday, talking about overall how we're going to change the use of health technology in America. We've got to get into 2025 with health technology, as is true in every other sector. If you're watching the show right now, you could also have been streaming media. You could take an Uber somewhere, the rideshare. You could do an Airbnb. Technology should make the system more efficient. We should have confidence that will also allow us to do what we all agree is possible. If the whole challenge to a work requirement is that you don't have confidence in our ability to accomplish it, that's a separate question, because I do have confidence in the American people, and we have confidence we can pull this off. Look at the passport system, Margaret. Right now, you can go and get a passport in 2 weeks without having to go to the post office, send pictures, and all that's gone. It's fixable. Let's use technology.
I'm still confused on how someone who is in the throes of substance abuse is going to use an app to say I'm in the throes of substance abuse every week to file on
when they go in to get their help for their substance use treatment, assuming they're going for help on that, they can also get enrolled and those requirements can be fulfilled. We want to touch them in as many ways as possible. It's not going to happen just because we put an app out there. You have social workers and other folk elements who care a lot about this population who are coming together, but they have to have some mechanism to report back. That just has not been done well.
Well, and this is incredibly detailed, and that's why we wanted to have you on. I have so many more questions for you on rural hospitals and some of the other criticisms. I have to leave it there for now.